So good morning, everybody. We are thrilled here today for the Lamont administration and the Connecticut Department of Public Health to announce the launch of our lead-free CT initiative. I want to first just take a moment to thank all the members of the Department of Public Health who've been working tirelessly on this effort and finally coming to see it to fruition, because we are going to be making a significant dent in a problem that we have in our state that is long-standing and be able to help protect children from getting poisoned with lead in the first place, or those that may already have it, help solve the problem that they currently have. So I want to tell you a story today of somebody very special to us, and that is Hugo, who's right here in this picture. Hugo is 4 years old. He tested positive for lead when he went to his pediatrician around the age of 2. He was approaching his 3rd birthday. And in the state of Connecticut, it is mandated that between 9 months of age and 35 months of age, you have an annual blood lead level done. And so it was on one of those screenings that Hugo had a test done. He was born in the height of the pandemic, so as we got through our first wave in July of 2020, and his mom, who came to Connecticut from Brazil in 2016, had never even heard about lead poisoning. It was not something that she was even aware of, and the risks of lead contamination. She didn't know that older homes can have lead. And where do homes have this type of lead? It's often, as you see, in peeling paint, whether it is on molding in the home, whether it is on the siding of a house, as you see on the blue house photo. Children play outside. A young child may eat soil, intentionally or inadvertently. The molding, as you see, can be peeling off. It might be on the floor. It might be in the dust in a room. You could see paint chips like we see in this photo, whether it be, again, on the side of the house or inside a house. And guess what? Lead is really sweet. So if you're a young child and you have either dust particles that are on your toys that maybe you're sucking because you're an infant or a toddler, or you notice that there's something in your house that's really sweet and tasty, you might be inclined to even eat more. And this is a problem that we see many children still have in this state. I have heard from so many families who've said to me, I thought that was like an old problem. Like, isn't lead paint in homes like something of the past? Well, guess what? We still have old housing stock right here in Connecticut. And you can see, even in a home like this, when assessments are being done, where we might be able to find paint in and around a home. So let's go back to Hugo for a second. He has been taking iron vitamins for the last couple of years to help treat his lead contamination and intoxication levels that he has, and he's doing much better. And one of the things I can say about Hugo is that I know he had some challenges in school. His mom told me at one point that people thought he was a little hyperactive or was having difficulty learning maybe at times. Now, was that because of lead? We don't know for sure, but we do know that his lead level was elevated. And I tell you this story because his mom, Monica, who's here in the back with us, who works in our communications department in the Department of Public Health, and I honor you, Monica, that you were willing for us to tell the story of Hugo today, because it just brings home that anybody and everybody can be at risk from lead poisoning. And many people are not aware of what the risks may be, but they can be profound to a young, developing child. And these potential risks can be irreversible, which is why it is so important that we identify this early and proceed with the steps that are necessary. And I want to thank Governor Lamont and the legislature who recognized that Connecticut needed to change our levels, our lead levels, which we've been doing over the last several years, so that by January, our level in a child that will prompt investigation will be 5. We've come down from a level of 20. Each year, we've made progress so that we identify these kids earlier and earlier to help give them their best shot at a proper and normal development and education in those early years of life where we know is the biggest impact we can make. So we're unveiling this effort today, and you're going to hear from many people after me about how exactly people can engage with this. And I will tell you that Monica went to leadfreect.org and signed up through Connecticut Children's to have her house be one of the first, hopefully, that will have remediation done. And so everybody can do it. And you're going to hear a little bit more now. And I want to just take this opportunity again to thank everybody who's been instrumental in getting us to this point. So now I'd like to introduce DPH Deputy Commissioner Lisa Morrissey, who has been helping to lead this initiative.
Good morning, everyone. Excuse me. First, I want to thank Governor Lamont and our legislators because today is a monumental day for Connecticut. Today marks the day that Connecticut has decided that we're making an investment in our children, that we are going to lean into primary prevention of lead exposure and intoxication. And what does that mean? All of the investment that we made in lead to date have been reactive. We wait until children have been exposed to lead, they're poisoned by lead, and then we do what's called secondary and tertiary intervention, right? Which means that we're now trying to prevent further damage. We're trying to mitigate the impacts to their education, to their medical needs, to the future economic status for their family. By doing the primary prevention, we're going to stop that cycle. We're going to prevent children from having those impacts in their school. We're going to give their families a better future, and that's historic. And it's because of this investment that we were able to partner with CCMC and our local health departments to accomplish this. Families can contact their local health department, or they can go to the website, Lead Free CT, to make that application, to learn more about where can they be exposed to lead, how do they break that cycle, how do they find out more information about, is the paint in my house safe, is my water safe, who can help me with that? And it's because of the expertise that we do have in our local health departments and in our partners such as CCMC that we are able to have contractors who are able to come into houses, right, to remove those leads. We can have our local health departments have home inspectors that have their home inspectors, the public health inspectors or sanitarians go into the homes, make those evaluations, work with families to come up with plans. As the commissioner said in the case of Hugo, our local health departments have nurses and inspectors who are going in and advising families as to how they can work with their medical professionals, how do they work with their clinicians, so that we have a continuum. This warm handoff and this whole community approach is what makes Connecticut so special and what makes us a leader in this arena, that our legislators, our local health departments, our public health, the entirety of Connecticut is behind this initiative. And I just want to thank everyone today for all of their support, and I want to thank the team at DPH. I want to thank our partners, like I said, at CCMC, the Office of Early Childhood, the Office of the Department of Housing. There are so many agencies who are not in this room today that also helped make this initiative so special and will contribute to its success. So thank you.
So today we're unveiling the first part of a series of initiatives that DPH is going to have around removing lead. And we're focusing on the American Rescue Plan Act dollars, and I want to thank Senator Blumenthal for your advocacy to bring ARPA dollars to Connecticut, that we are able to do this specific initiative right now. And so next I want to invite up Bridget Fagan, the Chief Financial Officer from Connecticut Children's, who is helping to advance this specific intervention and the partnership with CCMC that we have going forward. Welcome.
Thank you for the offer. Good morning, everyone. I'm vocally challenged today. First off, I would like to thank Governor Lamont and Commissioner Jadani and distinguished members of the Connecticut delegation. I am honored to be here today to celebrate this monumental $15 million grant from the Department of Public Health for Connecticut Children's Healthy Homes program. At Connecticut Children's, our mission extends beyond exceptional health care for our young patients. It encompasses ensuring that the children of Connecticut have a safe and healthy environment to which to grow and thrive. This grant represents a significant step forward in our partnership with the state to address and eliminate lead paint hazards in older homes, which is crucial for the well-being of our children. Soon you will hear from our program director, Chris. This initiative targets Connecticut residents who meet the program requirements for lead abatement. And one thing I will stress that there's no income limits to this program. Lead poisoning does not look at income, so it's open to all Connecticut residents. Our Healthy Homes program is dedicated to making homes lead safe at no cost to the families. This initiative not only protects the health of our children, but also contributes to substantial healthcare savings. Of course, I have to add in costs. I am the Chief Financial Officer. So investing in lead poisoning prevention, keyword prevention, yields significant returns and reduce healthcare costs. Connecticut Children's is proud to stand as a partner to the state on this work and to all the children of Connecticut by making a tangible difference in the lives of families. Together, we will create safer, healthier homes and pave the way for a brighter, healthier future for our children. Thank you.
I'd like to now invite up Chris Corcoran, the Program Manager from Connecticut Children's Healthy Homes.
Thank you, Commissioner D.C. Morrissey and Bridget, Governor Lamont, and Senator Blumenthal. My name is Chris Corcoran. I am the manager of the Healthy Homes program at Connecticut Children's. And for over 20 years, Connecticut Children's Healthy Homes has been making homes lead safe and healthy for families across Connecticut. This is an epic grant, though, and we have an opportunity now to be working, as it was mentioned earlier, on the prevention angle. So it's really important to think about how we get into homes to make sure that if there's a child that's been lead poisoned, let's make sure if another child lives in that unit in the future that they don't get the same exposure to lead. And it's also key to remember that lead poisoning is 100% preventable. So taking these steps to make homes lead safe across Connecticut will reduce the likelihood of kids being exposed. Again, going back to the idea of the primary, because once the kid is exposed and has a lead level above 5, for example, in some ways the system's failed. So we're trying to make sure that we do our best to prevent that exposure. It was mentioned earlier, too, that the investment for children, Connecticut Children's is focused on making homes safe and healthy for kids. It's also focused on making sure kids thrive, that they get the best care available, and that they get to live to their full potential. So with the healthcare system costs, it was mentioned earlier, the National Institute of Health actually shows that for every dollar invested in lead poisoning prevention, the return can be up to $221, resulting in like $280 billion in savings. So we have the opportunity here to have a significant impact on the cost to the healthcare system, but more importantly, let kids thrive, let kids live in a safe and healthy environment, and also stability. You know, by having homes that are made less safe, less likelihood that the renters might move to a different unit in the future. So that stability, along with the affordability, along with the safety, has been the focus of Connecticut Children's for many years now. Like I said, over the last 20 years, we've been making homes led, safe, and healthy across Connecticut in partnership with the state of Connecticut, traditionally through the Department of Housing. We've been working with the Department of Housing for over 8 years now, so this is an exciting opportunity to launch our first effort, making homes lead safe. We've had great support working with the Department of Public Health on surveillance of lead levels, on finding contractors that we need in the past. So this is a unique opportunity to bring the combined expertise of Department of Housing and Department of Public Health together so we can implement this grant and successfully we're looking at making over 250 homes lead safe in Connecticut, across Connecticut, which is a significant number in a short period of time. I'm not going to tell you it's not a little bit nerve-wracking, but fortunately I have a very strong team of people that are ready to do this work, and with the support of the Department of Public Health and Department of Housing, we're going to make it happen. We'll be looking forward to breaking ground on our first project in late August. So thank you very much for your time.
Thank you very much, Chris, and we do look forward to getting roughly 250 to 350 homes taken care of. We know it's a tall order in a very short period of time, but we think we can make it happen. So now I'd like to invite up the co-chair of the Public Health Committee, Senator Anwar.
Good morning, everyone. Thank you, Commissioner Jatani. So I'll take you back to January of 2022. We are in a difficult situation with the pandemic. And at that time in January, I look at the bills that have been proposed by our governor, and I see that one of the priorities that our governor has is to be able to address the lead poisoning in our children. I was so proud at that moment to see that our priorities are right. We are looking at an old enemy that has had an impact on the well-being of thousands of children historically in our state. And this is how the system works. We have the federal delegation with the leadership, Senator Blumenthal, Congressman Larson, and others who have been focused to try and get us the resources. And we have a very robust Department of Public Health with the leadership and priority setting with the commissioner and the governor, who actually said we have the resources. In this building, resources are the biggest challenge, but when you have them, you want to try to get the highest return on investment. And what could be more important than taking care of our children? So that bill, the House Bill 5045, the governor's bill, I was one of the first few, actually maybe the first one to be able to co-sponsor right away. I clapped when I saw this. I was so proud of our state, and we have done it. We passed this bill. We have changed the threshold of how we define lead poisoning. We have made sure that any child who's going to be impacted, there will be an in-person visit to that house. We are going to try to find the source of it and address this. This is like what you would want to see as soon as you open a textbook of how do you do public health. This is a textbook case of how you do it. Lead is a dangerous neurotoxin. This neurotoxin gets into the blood, but it is one of the neurotoxins that goes from the blood into the brain. It crosses what we call the blood-brain barrier. When it crosses the blood-brain barrier, because the blood-brain barrier is supposed to protect us from all toxins, except the brain barrier thinks it's calcium, and it allows it to go through. And when it goes through, it takes away a young child's ability to have the full potential. And for the next 50, 60, 100 years of that child's life, they will not be able to get that full potential. And that's why it becomes relevant to find this early, address this early. The other thing that this does is it actually crosses the placenta. So when a woman is pregnant, it would go through the placenta into the fetus and would have developmental disorders affect the brain as well at that particular time. We are in the state of Connecticut coming together with one strong voice from the top, from the federal level, from the state government, from the governor's office to the Department of Public Health to the local communities in everyone, and through our hospital system, the Children's Hospital, which is identifying and seeing the bad case scenarios that have happened and who know how to identify this, and then creating this full circle to say no more. While lead is strong, we in Connecticut are stronger. Thank you.
unveiling the first part of our initiative. What will be coming down the line is additional unveiling regarding removing lead service lines that are in our communities and connecting to homes. There is a piece of this that the water systems are doing directly, but there is a piece that is also going to be required from families. And what does that mean? As you see in this slide, there is a part of the property line that is owned by a consumer versus the part that's owned by the system and in the street. And this is going to require a lot of work in terms of digging up streets, having water systems going into the ground, taking out these old lead service lines. Many of them go back to the 1800s. And there's a part in terms of, you can see this part that's circled with in red, lines that are going directly into the home. And why am I mentioning these today? Because apart from the work we're talking about that is funded by American Rescue Plan dollars appropriated by the legislature in our state budget, it is due to the leadership of our federal delegation and the Biden-Harris administration where the bipartisan infrastructure law was passed. And this allowed for an infusion of money to the state, to the Department of Public Health, to remove lead service lines from our streets and those connections to individual homes. And I say all that because we are graced with the presence of Senator Blumenthal and Congressman Larson, who I'm glad was able to join us. And so I'd like to thank them for their efforts with the bipartisan infrastructure law and turn it over to Senator Blumenthal now.
The record should reflect that Congressman Larson entered as Commissioner Duthani was talking about digging up streets. So, Congressman, thank you for being here to do the heavy lifting. I want to really, I want to thank Governor Lamont because it would be easy to disregard or dismiss this problem of lead poisoning. You know, lead is a crippling poison, but it's invisible. It's in paint, it's in pipes, but there's no evidence of it until a child becomes sick. And often the only way to tell that a child is sick is through testing that is costly and often inaccessible to families who don't have the means or the awareness to seek it. So raising awareness is absolutely critical. That's what Governor Lamont is doing here. That's what Commissioner Duthani and her team do constantly. Children's Medical as a partner here is absolutely vital. Anybody who's ever visited Children's Medical knows the miracles that happen there, and I'm always in awe of the great work that is done by your facility. And the federal government has a role, more than just an optional role. It's imperative. I've been working on this issue for a couple of decades at least. As Attorney General, we were involved in litigation against homeowners, principally development owners who failed to do the right thing, against paint manufacturers. Remember that paint used to contain lead, no longer does, and it's primarily in homes built before 1978. So we are dealing here with the aftermath of a deep-seated failure on the part of those lead manufacturers. Many of them have gone out of business because of their financial responsibility for the crippling health effects. When teachers tell parents Johnny is slow, Johnny's not slow. Johnny often has lead that is crippling developmentally, educationally, financially, in all kinds of other ways. But this federal investment is just a down payment, just a drop in the bucket of what is necessary. $20 million is important, but the federal government ought to be doing more. And that's why we should regard this program in Connecticut as a model for what states should be doing across the country. It ought to be a call to action for the federal government to do more, an example of how ingenious and determined state public health measures can make a difference in people's lives, literally make a difference in those lives of little children whose parents may be told, Johnny's slow, but it's not Johnny's fault, and it's not some genetic failing. It's paint in the walls or in the pipes that deliver water to homes, and Johnny deserves better than to be regarded as slow. We owe Johnny more. Thank you.
And I'd like to now call up Congressman Larson.
Thank you, Commissioner, and let me associate myself with the remarks of Senator Blumenthal, except for the part where I didn't know whether he was calling me a streetwalker at the beginning, or, but nonetheless, it was just as well that was down for that. So, well, listen, I want to commend Governor Lamont and the Commissioner and the outstanding work that you're doing. I think the Senator has gone through the legislation. I concur. What? You can't hear me? Can you hear me now? All right. I want to associate myself with the remarks of Senator Blumenthal. I think he went through it extensively, and also indicate that this is the start in what is an important an ongoing and necessary program. But it doesn't happen without leadership. And I want to commend Governor Lamont and the Commissioner and the members of the Connecticut General Assembly and the leaders here today. That's important that we remain persistent. If you listen to Senator Blumenthal, persistency is something that is vitally important. Throughout a career as Attorney General and then as United States Senator, we know that we can never take our eye off the prize. But to have a governor and a commissioner with this kind of capability recognize that this is how the money will be best utilized is the best way for us to proceed and continue to work with the great state of Connecticut. Thank you so much.
And now I'd like to invite up Governor Lamont.
Well, Johnny Larson, I don't think you're slow. And more importantly, you know, Dick and John and our incredible delegation, I hope you're able to remind your folks down in Washington what a difference this ARPA money is making and how Connecticut is putting it to good work and making a difference right here, starting with public health and Manisha and the entire team. Look, as we get our transportation system more and more carbon-free, that also reduces asthma levels. As we upgrade our ventilation systems in the schools, what that means in terms of air purification and what that means in terms of respiratory. As we try and clean up the brownfields and make sure that those old industrial sites are safe for future use, and we can't do it without the support of our federal delegation, who's just been absolutely extraordinary. And that's what this event is about today. I mean, it's easy for me to say, kids, don't eat lead paint, but we're talking about, you know, 2, 3, 4, 5-year-olds. We're talking about old homes. We're talking about paint that's been there for a while, chipping off. It's not a matter, a lot of it's in the dust. And we're doing everything we can. Parents, make sure those youngest kids, make sure they get tested. That's a requirement. And secondly, If you want some support, we've got the support here right now. They can, you can do, what is it, Connecticut?
Leadfreect.org.
Yeah, or just dial 211. That's a lot easier for me to remember. They can give you all the information you need. Children's Medical is just extraordinary. They'll go out, they'll do an assessment on your home. Let's see what we need to do to make sure your home is safe for you and your kids. We'll take care of all the work that has to be done, but now it's up to you to take advantage of the services that are out there. You know, usually I'm telling universities, you don't have to spend all the ARPA money at one time. I'm saying in this case to our departments of public health and Children's Medical, we got 2 years of this money. I want to make sure it goes to work and makes a difference for these kids now. Thanks, everybody.